Well, pinpointing pain, dry needling, certainly growing in popularity.
The up-and-coming technique uses tiny needles to treat and manage pain. Our Lynn Bowie tells us more about the treatment and why one woman calls it life-changing therapy.
I'm basically using my fingertips to try and get to some of these muscles that underlie the back of her skull.
A car accident last year left Sophia Fuchs with nerve damage and debilitating headaches that kept her in bed all day.
We tried different medication, but nothing helped. And my doctor recommended perhaps I should do surgery. But I was not thrilled in doing surgery right away.
You're doing great.
Instead of surgery, doctor of physical therapy Simeon Mellinger at Sinai Hospital began using a technique called dry needling.
So what did you think when it was recommended to you?
I said, hey, why not? I'll try it. I have nothing to lose. But of course, the thought of having a needle going into my back, it frightened me a bit.
Maryland was one of the first states to allow physical therapists to dry needle patients.
What is dry needling therapy?
So dry needling therapy uses a very tiny needle, we call it a monofilament needle, and it's similar to an acupuncture needle, except we target trigger points within the muscle. And a trigger point is essentially a muscle knot that refers pain elsewhere.
Mellinger says the pain from the needle feels similar to a Charlie horse.
I would say the pain is minimal to moderate, and it only lasts a few seconds. And really, the patients that come to me, they're at the point where they'll do anything to get rid of the symptoms that they've had.
Once the needle is in the trigger point, physical therapists can connect it to an electric current.
We can increase the intensity of that current to get the muscle to contract and relax. And we find it has a bit of a neuromuscular effect on the muscle to get it to calm down.
Dr. Jan Dommerholt, president and owner of Bethesda PhysioCare, was the first person to teach dry needling courses in the U.S. in 1997. He says he's seen the technique's popularity grow exponentially.
It becomes very popular because it's so effective. So I think that more and more physical therapists and chiropractors and now occupational therapists more and more are approved to do this. Athletic trainers even in several states now can do dry needling. I think that all has contributed to this very sudden growth.
Dry needling is typically part of a larger treatment plan. With their pain diminished, patients can do therapeutic exercises and strengthen the muscles around the joints.
So not just this magical little stick with a needle. Yes, it helps a lot, but if patients don't change what they do after to take advantage of that new ability, it's probably not going to be that effective.
After 4 weeks of dry needling, Fuchs' headaches are more mild and happen less frequently.
In the past, when I would have these terrible, terrible headaches, I would stay in bed and try to sleep all day. But now I feel much better. I don't need to go to bed and just stay in bed all day because it has helped me.
So it's completely changed your life.
It changed my life, and I hope I will get rid of my headaches completely. That's the goal.
So now I'm going to take the needle out.
A turning point in her recovery. Lynn Bowie reporting for WJZ.
All right, if you'd like to know more about dry needling, we have more information on our website. Just head to WJZ.com.